by, say, for example, 2, then they can form a sharp image on the retina. So this is how the hyperopic patient do. Okay, so when you are young, I think you can still do it without any problem. So if you have hyperopia, what you can do is to accommodate so that you can bring the image back onto the retina or closer to the retina as you at least, then you can get a better vision. Okay, and for that reason, if you have a hyperopic, okay, and probably you don't need to have a spectacle, because when you increase your accommodation, then you can have sharp vision. The people, if they don't go to see an optometrist or ophthalmologist, they may even know that they have hyperopia. In that case, they may develop this presbyopia earlier than the amateur, okay, if not corrected. And the reason for that is because they already use part of the accommodation to compensate for the near vision, for the distant vision, sorry. So, and that's why they don't have much accommodation left for the near vision. Okay, so if remember the diagram that I showed you, by 40 years old, they may only have about 5 diopters of accommodation. Okay, 5 diopter. If you have a hypro, 2 diopter, so that means they already use up like 2 diopters of accommodation to compensate for the distant vision, and that's why they only have 3 diopter left for near vision. 3 diopter left, that means the patients can put the objects at about 33 centimeters in front of the eye if they use up all the accommodation. But then he will become, I mean, for example, like get fatigue very easily, because if they look at the objects at 33 centimeters, that means they have to use up all the accommodation at all time, and that will make the eye very tired, and that's why they may develop the symptom very, very early. So for hyperop, usually they will develop the presbyopia earlier. And for myope, it's the other way around. I mean, if you are myope and you're uncorrected, okay, a lot of people who when they have a mild myopia, so they may not use any like a spectacle. For example, if they have 2 diopters of myopia, so the image will be forming in front of the retina. But then, if you have 2 diopter or 3 diopter, maybe 3 or 3 diopter as an example. So for distant vision, if they don't do any correction, of course, their distant vision may not be very good, okay, because the image will be forming in front of the retina. But for the near vision, is perfect because of the excessive power. So 3 diopter. 3 diopter of myopia. Remember when we discussed about the optometer, 3 diopter of myopia, that means the far point will be at 33 centimeter in front of the eye. So that means if you put something at 33 centimeter, you don't need to accommodate. So that is like a perfect fit. Okay. So when you have myopia being uncorrected, so when you look at the near objects, okay, if the far point, okay, is at the plane that where you're looking at, then you get perfect vision without using much accommodation. So as you can see here, you can get a clear vision simply by removing your distant spectacle or distant correction. Then you can see the near objects very clearly. And this is how you look at the people who have myopia. So what they normally do is when they need to look at something at near, so they simply remove the spectacle, okay, the distant spectacle, so that they can have clear vision at near. Okay. So that's why a lot of people would ask if I have myopia, whether I still have presbyopia. Answer is yes. Okay. So presbyopia affect all people, including myopia and hyperopia. So this is this is like a misconception that the people who have myopia would have no presbyopia. But the situation is that if you have myopia, when you look at something at near, if you simply take off your spectacle, then you will get a better, at least a better vision for that near objects. And that's why the people thought that for the myopic patients, they may have no presbyopia. And in fact, this is not correct. Okay, so far, do you have any question for me before we talk about the move on to the second part of my talk, which is on the stimulus for accommodation? Any questions? Okay, if not, then I will continue. Okay, so in this part of my lectures, I will talk a little bit more about the stimulus and the response for accommodation. Okay, there are several stimulus for accommodation. If you look at these two figures, okay, the one on the left is when you are looking at distant objects. Okay, so you can see that the yellow lines indicate the fovea to fovea, and looking at the same objects. Okay, so this is the convergence required for looking at this distant objects. And if you change it to a near objects, okay, so you can see that so the objects will be brought closer to the patient. And if you still want to fixate on it, okay, fovea to fovea, so what you can see that the convergence increase, okay, convergence increase when you're looking at the near objects. So the first stimulus for accommodation come from the retinal image. Okay, when you change the objects from distant to near, without changing the power of the eye, okay, of course, one thing you will realize that is that for example, if you are looking at these objects, so these objects without accommodation, so you will expect this image will be forming behind the retina if we assume that the power remain unchanged. Okay, so meaning that you will experience an out of focus image projected on the retina, and that is the the primary stimulus for accommodation. So when you have a blur image on retina, so that means you are not in focus. I mean, your optical system is not in focus. And in order to get focus sharp image again, then you have to accommodate. Okay. So the first one is of course is a defocus image, is an out of focus retinal image, will trigger accommodation. The second stimulus for accommodation is convergence. Okay, convergence. Convergence also work together, work in parallel with the accommodation. So, for example, still using this diagram. So, if you bring the objects from this position closer to the eye, so that means the eye, if they want to see an image on the fovea, so they have to keep converging. And when you converge the eye, so the accommodations comes in, okay, because they work together. Whenever you are converged, then it will increase the accommodation because they just work together, okay, hand in hand. Okay, so convergence is the second stimulus for accommodation. The third is also related to the second, actually, is the awareness of proximity. So meaning that if you put something very close to the eyes, okay, something very close to the eye, and even if you cover one eye, okay, if you cover one eye, so you won't converge because you don't need to converge if you only have one eye. But if you put something very close to the eye, okay, so, and because it's also related to the first one, is when it's very close to the eye, okay, so probably it will also cast a blur image on the retina as well. And that's why the patients will start to accommodate. Okay, it's awareness of the proximity. Fourth is darkness. So that means if you're in a total dark room, okay, if you're in a total dark room where you can't see anything, okay, your eye will accommodate. Your eye will accommodate in a dark room. Okay, and the reason for that is not that clear, but it might be related to the last one. It's related to the spherical aberration, because when you have in a dark room, so the spherical aberrations increase. Okay, because you have like a dilated pupil. When you have a dilated pupil, a bigger aperture, so the amounts of spherical aberrations will be increased because that is controlled by the pupil size. When you experience an increase in the spherical aberration, okay, meaning that you have a dilated pupil, so it will trigger the accommodation too. So this diagram illustrates what happened when you accommodate, or what happened when you are presented with accommodation stimulus. So first, I want you to look at the bottom part of this slide. So this is serving as accommodation stimulus. So meaning that you are presenting objects to the patient to look at. This is when you present the objects at infinity. So this is at infinity, like a distant objects for some time, okay, and then you change to a near objects presented at 50 centimeter, okay. At 50 centimeters, that means you expect that the accommodation stimulus is about 2 diopter, because 1 divided by 0.5 is about 2 diopter. For some time, back to a distant object for some time, and then go back to the near objects. Okay, so we do this like in a cycle. So alternatively, now we look at the response. So if you look at the response, so what you can see is that the shape looks more or less the same as the stimulus. Some of the key things that you should bear in mind is that, for example, we can look at the first part here. When you change your fixation target from distant to near, okay, so now you can see for the eye, it will take a bit of time before it can respond to this stimulus. So even when you change it to a near object, it still takes some time for the